Hello and welcome to another edition of Fresh Natural Live. I hope you had a great Monday. We had a little bit of cloud and some rain and some sunshine here in the Houston area. I hope the weather's nice where you are. And of course, I hope you had a beautiful and productive weekend. As usual, we have a great show tonight. I'm going to be talking about myocarditis. A few weeks ago, maybe 1 or 2 weeks ago, I did a presentation on a 13-year-old kid who had died from myocarditis approximately 2 to 3 days after getting a second dose. I think it's the Pfizer vaccine. And individuals raised a lot of questions about myocarditis and the like. And I wanted to put this whole thing in context because myocarditis is a condition that is we see quite a bit in cardiology, and as a cardiologist, I've treated a number of patients with myocarditis over the years. So I thought I'd do a little short discussion on this just to give you some perspective. I'm not going to belabor the point too much. So just sit back and relax, and we're going to cover quite a bit of information here. I'm just going to give you the basics on myocarditis, and then I'm going to open up and give you my perspective in terms of how I manage patients with myocarditis and how we address this. So sit back and relax and enjoy the show. Okay, welcome back. And so I'm going to get right into this. So part one, I'm just going to give a general overview discussion on myocarditis. And I want to just share with you, what this diagnosis is, what does it mean? So in essence, myocarditis, what is it? What do we do about it? So I'm going to go through the basic aspects of it. So, the overview and the general concepts of myocarditis, it's an inflammation of the heart muscle. If you look at myocard and itis, and you break down those words, and many of you who are medical people out there, understand this, but for our non-medical listeners, myo is muscle, cardio is heart, so heart muscle, and itis. Whenever you have itis, that's an inflammation. Now, it could be an inflammation due to an infection or an inflammation due to some other cause. So it doesn't have to be an infection, but, infections cause inflammations, autoimmune response cause inflammation. The final, the common denominator is your inflammatory system is revved up. So, some people have arthritis, bursitis, or that's inflammation of the bursa. So any itis is inflammation. So here you have inflammation of the heart muscle, which is the word, what is broken down in the word. So it can affect the heart muscle and your heart's electrical system. This can result in reducing the heart's ability to pump. You can have a rapid abnormal heart rhythm. We call that an arrhythmia, A being abnormal rhythm. And so myocarditis can cause the heart to be enlarged and weak. It can cause the heart to beat rapidly. I have a number of patients coming in with palpitations from time to time, a rapid heartbeat. They may have myocarditis. They may have other causes also. A viral infection can cause myocarditis. And we're talking about COVID-19. Individuals can get, with long COVID or regular COVID, you can get inflammation of the heart muscle. A common, well-known infection that we know about is strep throat. Some individuals get myocarditis with a strep throat. They can also have valvular disease or pericarditis, which is the sac around the heart become inflamed. So it could be a reaction to a drug also. And of course, we talked about vaccine-induced myocarditis a couple of weeks ago. Or it could just be a general inflammatory condition related to an autoimmune disease. So And these are the things that are associated with. Myocarditis can be associated with other types of things that go with increased inflammation. So you can have clots that form in the heart. They can lead to stroke or heart attack. So even though myocarditis is inflammation of the heart muscle, it's associated with inflammation that's in other places, and inflammation can cause the blood's coagulation system to become unbalanced, and you can cause excess clotting. And so people can have pulmonary embolisms and strokes and heart attacks and the like. So this is what we're dealing with heart attacks. And so you can also have other symptoms. So what are the typical symptoms that individuals have with myocarditis? And signs and symptoms we look at. If you have a serious infection, individuals with serious infection can have chest pain. They can present with abnormal rapid heart rate. They can have shortness of breath. They can have fluid retention and swelling of the legs and ankles and feet. They can have generalized fatigue. It could be very subtle onset. Heart failure can present as fatigue, and individuals with fatigue can have heart failure. Other signs and symptoms of viral infection. So if you have myocarditis with these rapid heartbeat, you may have GI symptoms or runny nose, sinus congestion. So you may feel like you have the flu with associated palpitations or abnormal heart rhythm, or you may be in heart failure with the flu. And so the viral infection may cause flu-like symptoms, which causes a systemic inflammatory process, which can also have an increased inflammation or inflammatory trigger in the heart. So fever, joint pain, sore throat, etc. So the inflammatory process is one where, yes, you can have myocarditis. It can be associated with other things. It could be myocarditis by itself. It could be myocarditis with pericarditis. Pericarditis, the pericardium is a sac. It's kind of a fat sac that sits around the heart, and it cushions the heart from traumatic blows and movement of the chest. So that sac can become inflamed as well. So we call that pericarditis, and that can be associated with chest discomfort also. Children can have fever, fainting spells, breathing difficulty, rapid heartbeat. They can also have arrhythmias as well. So similar to adults with serious reactions, kids can have similar reactions. They may present more with a systemic viral infection with an associated myocarditis. What are the causes? I mean, the causes are numerous, but it's a simple list. You have viruses, bacteria, parasites, and fungi. These are the microbes. So any kind of infection can cause myocarditis. Well, why is that? Well, the infection can rev up your immune system. And whenever the immune system is revved up, you can have an autoimmune process, which means that the immune system, it revs up. Sometimes your immune system misbehaves, and it can attack parts of you. So just like somebody that may have arthritis associated with an infection or something else, the immune system can be revved up, and so you can have that issue. Hello, everybody. It's watching and waiting. Hello, how are you doing? Deborah Payne, welcome to the show. Barbara Perlis, welcome to the show. Felicia Selman, welcome to the show. Carol Hoskin-Burtz, welcome to the show. Good evening. I'm glad to see you guys on. And send all your questions your way. But pericarditis and myocarditis can also be associated with medications, illegal drugs, legal drugs. You can have an allergic or toxic reaction. So that can also cause myocarditis as well. Chemicals or radiation. Some people have radiation to the chest for treating, say, breast cancer, can have a myocarditis or pericarditis associated with radiation or chemotherapy. So, you can have these chemical diseases, or there are other diseases. Chagas disease. Chagas disease it's an infection. Used to be one of the most common causes of heart failures, and mechanism of myocarditis causing heart failure. Other chronic illnesses, long-standing chronic illnesses, infiltrated disease can be associated with myocarditis as well. And so, these can be very rare, but they do occur. So what are some of the complications of myocarditis? Heart failure is one. I've had patients. I remember one patient I was managing. It was a lady in her 70s, I believe, mid to late 70s. And she came into the hospital very acutely ill and congestive heart failure. She was having a lot of arrhythmias. And emergently took her to the cath lab, did coronary angiogram, did not see any significant obstruction. Put her on antiarrhythmic drugs, and tried to manage her clinically. We even gave her some steroids, but she had a very fulminant case of myocarditis, and she eventually died, unfortunately, at that time. And so again, you can have very acute cases of heart failure. And if you have an overwhelming amount of myocarditis, you can have a rapid demise. And so that was a situation in her case. Oops, I didn't go to my others. So a heart attack or stroke, individuals presenting with a heart attack. A heart attack, by the way, is an acute inflammatory reaction, by the way. The way a heart attack occurs, you can have an unstable plaque that can rupture. And the rupture of that plaque allows the chemical components underneath that plaque to be exposed to the blood, and that causes an acute reaction. Many of you may be familiar with cytokine storms, from talking about it with COVID. Well, cytokine storm is nothing more than an acute reaction, an inflammatory flare-up, and the autoimmune system. The cytokines are some of the mediators that perpetuate this cascade of enzymatic reactions that cause the immune system to go on. And this is a good thing if you're fighting, microbes or things that are foreign. It could be a good thing if you are trying to repair a blood vessel that's severed or damaged, and where you're losing blood, you have to form clots at that site and so on. So these cytokine storms can be protective. However, if they are excessive or if they're triggered in the wrong way. So like you have an unstable plaque in the coronary artery, it ruptures, it triggers a cytokine storm right there, and it causes a clot to form. Where if you have myocarditis, that could be associated with a systemic reaction. So the heart muscle can be inflamed, but the arteries can also become more inflamed as well. So while myocarditis is going on, you can also have inflammation of the blood vessels. Some of these unstable plaques can rupture, and you have a heart attack associated with myocarditis. Rapid and abnormal heart rhythms. As I said before, in the outset, and there's some interesting questions coming. I'm going to get to those. In the outset, you can have myocarditis that is associated with damage to the electrical system. So if you have damage to the electrical system, it can cause arrhythmias. The patient I alluded to had an arrhythmia because she had myocarditis. Because when you damage the heart muscle cell, the internal architecture of the heart muscle itself, you have electrical wires running through the electrical nervous tissue, if you will. And those nervous tissue can also be damaged, and it can cause short circuiting of the electrical system. And then sudden cardiac death. If you have such a severe abnormal electrical system, you can go into what's called ventricular tachycardia, ventricular fibrillation, and you can cause sudden death. People can drop dead related to a myocarditis that triggers a severe reaction. And that, I think, was the case with that 13-year-old that I presented. 3 days after the vaccine, he was found dead. Now, they didn't give all the details, but when they did the autopsy, they saw that he had myocarditis and an enlarged and swollen heart. And the mechanism typically by how you die that way is usually electrical. So you may drop dead to an electrical cardiac arrhythmia. So that might have been the mechanism by which, he lost his life. But so myocarditis can have major effects. Let me see here. Excuse me. Hello, Alfreda Kinsey from North Carolina. So Otis Granville, how to test for it? That's a great question. I'm going to get to that toward the end because testing for myocarditis is really tricky. And there's not really one definitive test with the exception of a myocardial biopsy. And so I'm going to address that down the road. So really, the diagnosis frequently is made based on clinical suspicion. There are some diagnostic tests that can point you in that direction, and I'll share some of that with you. What about vaccine that can cause it? There are a number of vaccines that can cause myocarditis, just like any medication can. Many of you are aware that there's been an uptick in myocarditis in young men who's gotten the COVID vaccine, but other vaccines can cause it, other medications can cause it, and infections can cause it as well. So Frida Kinsey wants to know, what's the difference between myocarditis and congestive heart failure? That's a good question. Myocarditis is a mechanism of damage to the heart muscle. So myocarditis is inflammation of the heart muscle that can lead to a number of things. Congestive heart failure is one of those things. So if you think about congestive heart failure itself, congestive heart failure is a clinical syndrome. It's a clinical syndrome that simply means that your heart does not circulate blood efficiently enough to meet your body's metabolic needs. That's as simple as that. So if you have myocarditis, it can lead to congestive heart failure. So myocarditis is an underlying disease mechanism that can lead to the clinical syndrome of congestive heart failure. However, you can have congestive heart failure secondary to other underlying problems as well. So to answer that question directly, the difference between myocarditis and congestive heart failure, one is a mechanism of damage, and the other one is what we would call a clinical syndrome, where it's associated, it's an abnormal physiological condition where the heart does not circulate blood commensurate to the body's metabolic needs. And so, good evening, Liza Marie. And so, why does the vaccine cause heart problems? Please tell me. So, the detailed mechanisms are not worked out there. So, what I can say is this: we know that the vaccine, or any vaccine for that matter, works by means of triggering the immune system. So, on that basic premise, anything that revs up the immune system, whether it's an infection or a vaccine that mimics an infection, in theory can rev up the immune system in a way where your body can be, the immune system could attack self. So in other words, if you rev up the immune system, you're trying to trigger antibody production. In that process, the immune system will be revved up, and there can be an autoimmune trigger that can result in myocarditis or any other kind of. Remember, when people get the vaccine, they get fever, chills, they get a soreness at the muscle site, the injection site. That's a myositis in of itself. It's a skeletal myositis. They get a systemic inflammatory process with fever, chills, et cetera. That's just revving up the immune system. So it's not too far-fetched that you can have an autoimmune process that can cause, myocarditis or any other kind of underlying condition associated with increased immunity, autoimmunity. Let's see here. Is this a question from Shonda? Good evening, everyone. I too would like to know the mechanism behind why the vaccine is triggering heart problems. Yeah, so again, one mechanism is revving up the immune system. Now, there's a lot of talk about the potential cytotoxicity of the spike protein. I think more evidence needs to be looked at, and that needs to be studied. And I think as we look at this over the long term, we'll understand this better. So there could be other mechanisms too, but certainly a simple, straightforward mechanism is that anything that triggers the immune system, revs it up, can cause an autoimmune process, and that's simple enough. And a lot of times we don't know these detailed mechanisms because the immune system in its normal function is beyond our understanding, and certainly in its abnormal function is probably mostly beyond our understanding. Should a person with CHF healthy take the vaccine? I don't want to advise people what to do and what not to do online. I'm not advising my patients to take it for the most part, and that's just based on my clinical evaluation of them. But I mean, if you have CHF and you see a cardiologist, I'd recommend you talk to your cardiologist. But work with my patient by different means because, that's just my approach. And I'll share some of my other thoughts later on in the show. Great questions overall. So what's the treatment? Well, the treatment of myocarditis isn't much different than the treatment for, any other heart condition. So there's no specific treatment for myocarditis in general. However, you want to make sure you treat the underlying condition. So if someone has heart failure due to myocarditis, they have swelling and shortness of breath, you have to give them a diuretic. Their blood pressure is high, you have to treat the blood pressure. So you got to treat the syndrome, the clinical syndrome that's caused by it. If they're having a heart attack, of course, you're going to treat the heart attack, etc. So you got to treat the underlying, the overall condition or manifestation of myocarditis. Now, in some people with persistent myocarditis, maybe it's long-standing chronic myocarditis, the immunosuppressant drugs can be used. In some cases, you use steroids in severe cases. So that is the way to do it. But my opinion is optimal nutrition is always the definitive intervention. And I'm going to, in the part 2 of this, share my thoughts and comments with you. There are a few interesting questions I'm going to catch at the next slide. So what I want to do right now is I want to take a short break. And after this short break, we're going to come back and I'm going to give you my take on this. So part 2 is going to be Dr. Montgomery's approach to myocarditis in specifically, but acute and chronic inflammatory conditions in general. So stay tuned, get your pens and pencils out, get your questions ready. We'll come with part 2 and I'll give you what I think about all of this. Greetings, I'm Dr. Montgomery. Thanks for joining us this evening. I want to share information about our Podiatrics Healthy Lifestyle Series. The Podiatrics Healthy Lifestyle Series is a comprehensive health and wellness coaching program designed to help you navigate your lifestyle towards optimal health. Do you want to reverse or control a chronic illness, or reduce or eliminate medications? You may want to avoid potential surgeries or medical procedures, or perhaps boost your immune system or improve your fitness level, or much more. The program starts with an intense 5-session, 4-week virtual coaching jumpstart phase, where you join a group of like-minded individuals dedicated to improving their health. You'll be provided a lot of support materials, including nutrition plans, recipes, supplement plans as needed, or fitness plans, and much more. You have full-year access to the support materials as well as our health and wellness team during and at the completion of the 4-week jumpstart period. To learn more about this program, connect on one of our links below or schedule a call with our team members. Let them know if you wish to speak to me directly and they'll arrange a time for you. Optimal health is a lifelong journey. Let us help you navigate it to your most desired destination. Okay, so welcome back. Welcome back to the show. I'm going to remove my slides here. So a number of interesting questions that's come up. Let me just go ahead and hit those questions first to make sure I don't forget. Somebody's asking me a very personal question. Do you still mask up, Dr. Montgomery? Do you believe in masking? The answer is yes, I do mask up. Whenever I'm doing procedures, I mask up. We do vein ablation procedures. I put the mask on and I scrub, but I don't mask up other times. And I haven't found any benefit in it, but that's just my opinion, and other people have their opinions, and I think people are welcome to do what they choose to do. So Candace Peterson, is a person at higher risk of adverse side effects or worsening autoimmune diseases if they have an existing autoimmune disease and get the vaccine? we haven't really studied this. I do recall, and I'll have to research this to see if there's any data since I've last looked. My recollection, and most of the vaccines, I think Pfizer, they excluded people with autoimmune diseases of certain types. And so there's not a large number of autoimmune disease people, to my knowledge, tested with a vaccine. As someone, if they know of any articles, share that with me. But I'm not aware of that to this extent. Now, I'm a busy cardiologist. I'm not combing the literature looking for these, esoteric questions to be answered. But so someone may have data, but to my knowledge, it hasn't been looked at. So, I can only speak from a theoretical standpoint. There's no evidence that is good for you or bad for you necessarily, because it wasn't heavily looked at. I tend to advise my patient with autoimmune disease to stay away from it because, again, you have an autoimmune disease because your immune system is not optimized. And so it's tripped up in certain ways. And we actually put our patient with autoimmune disease on a natural nutritional detox, and we do anti-inflammatory things. We don't do things that are pro-inflammatory, such as vaccines. So we may help them treat their risk for coronavirus in another way. So, but I don't have an answer to that question that's founded in a very good study that says, okay, we looked at 10,000 people with autoimmune disease, and 5,000 we gave the vaccine, the other 5,000 we didn't, and we followed them over 2 to 3 years, and we saw these differences. I'm not aware of that data. If someone's aware of that data, I'd like to see it. Now, maybe that data may exist in other conditions. It may exist with the influenza vaccine, et cetera. I just haven't, had the time to look for that question. So is the damage to the heart from myocarditis permanent? Great question. That's Felicia Selman. So once the inflammatory process is resolved, does the individual show improvement? The answer is yes, there can be improvement. So it varies. Can you have permanent damage from myocarditis? It's possible. A lot of patients that we see with, say, viral myocarditis or maybe other medication-induced myocarditis will have a flare-up, and then it'll get better. I remember, and I'll share this story with you because I think it's a great anecdote to address that. And first of all, let me back up real quick. The myocarditis is very difficult to diagnose, and I'm going to share that. That was a question asked earlier. I'm going to share a little bit of information on that in a few minutes. So it's difficult to diagnose, large because there's no set criteria, but it's mostly diagnosed on a clinical suspicion. But there are some biomarkers you can get. So it's hard to say, okay, this person has permanent heart failure is due to myocarditis, because when they developed the heart failure, they may have had myocarditis, and the inflammatory process came and went, the acute inflammation, and then left a damaged heart. So we have a number of people who have weak hearts. They don't have coronary disease, haven't had evidence of a heart attack, and we don't know why. Was it myocarditis or was it something else? And so part of answering that question is that, because myocarditis is something that, can be fleeting, meaning that, you have an episode that hits you real hard. It's there, it's flared up, and then the inflammatory process goes away, but you have damaged heart muscle. And so, yes, it could lead to permanent damage, but also you can have a reversal. And our experience, we had a number of patients with weak hearts or congestive heart failure. We put them on a nutritional detox and clean their system out and reduce the amount of oxidative stress. Then we've seen significant recovery in cardiac function. So, inflammation is not just a simple thing. You got a virus or you got a drug or whatever. It's probably a constellation of things. So let's say you take a medication and you have a reaction to that medication and it triggers myocarditis. Well, okay, you can say, well, this medication is associated with, but there may be other factors in your biology that contributes to that whole process of myocarditis. Maybe your immune system may be unbalanced. What we find is that, when people have an unhealthy lifestyle, there are many things that go into that unhealthy lifestyle. So the fact that you're maybe taking a prescription medication may be due to the fact that you have some underlying health condition that's due to some adverse lifestyle that's predisposing to all these things. So it's a buildup process. So the medication that you're exposed to or the viral infection that you're exposed to that causes myocarditis, it could very well be a straw that breaks the camel back phenomena as much as it is, okay, that one thing causing that one problem. So I don't want people to think, well, okay, this can cause that. It's oftentimes a constellation of things that build up over time. And that's why we, and my argument in terms of health treatment is to build up the body's overall health and well-being. So how do I treat heart failure? Regardless whether it's due to myocarditis or not, I start by building up the body's in its entirety. So I start with optimal nutrition, fresh air, sunshine. You want to move, you want to exercise, increases core temperature, increases sweating. Sweating removes toxins. We bring in lots of toxins with maybe foods we bring in, maybe unclean water, certain medications. So you want to remove all these things because, it's not just, we like in medicine, we like to isolate things. We like to say, okay, well, you took this pill and it caused this problem. And that may be true, but I think there are a lot of other things that are working in concert with that pill to also contribute to that problem or that infection or that whatever else the case may be. So that's why the treatment, if you have myocarditis or, something other itis, you don't want to just zone in on that, organ. I'm going to treat the myocarditis. I'm going to treat the whole body because the whole body needs to be managed in concert. That way the body works together. So when I'm managing my heart failure patients, I may look at the medication they're taking and say, well, look, these are putting stress on the liver, or these other medications putting stress on the kidneys. I'm concerned about the liver and the kidneys as well. I want the gut. I mean, these may be having an adverse effect on the microbiome. These may be having an adverse effect on the mitochondria. And so I'm going to be adjusting their therapeutics, keeping many organ systems in mind, not just the cardiovascular system. And that's very, very important because these systems work in tandem. They work in concert. Even if the heart is weak to a certain extent, if you strengthen the liver, strengthen the kidney, the heart may not be 100%, but it's going to get extra help from these other organs. A heart is only beating 50%, 30% or 40%. If you have a liver that's compromised, a kidney that's compromised, that heart function is going to be even further compromised. So it's really important that you look at this in its entirety. Also, natural, healthy antioxidant diet, as I said, decreases oxidative stress, and it also decreases inflammation. And we show that clearly in our publications in individuals with reduced C-reactive protein, reduced IL-16. All these things are associated with increased inflammation, increased cytokine storms. And myocarditis is a localized cytokine storm that affects the heart primarily. And so, who is this? Darren D. Hi, everyone from Seattle. I guess you're from Seattle, Darren D. Make sure to hit the like button. Thank you for that reminder. Make sure you hit the like button and subscribe. And please share this video if somebody you think will benefit from this. Hello, Sonia Anderson. So again, myocarditis is an inflammatory condition that affects the heart muscle. There's an associated condition called pericarditis. They are related. Oftentimes they coexist. But it's nothing special in the sense that, oh, this is some weird health condition we're seeing after the vaccine. We've seen myocarditis around for a long time, and it's inflammation of the heart muscle, and it can be treated, in my opinion, by improving the overall body's well-being. If I have somebody with acute myocarditis, what will I do? Well, I'll put them on a nutritional detox. I'll put them on methylsulfonomethane, that's an elemental sulfur. I will start them on a liposomal curcumin that we use for our patients that decreases inflammation. I'll start them on the liposomal vitamin C, and if warranted, I may give them intravenous vitamin C. Vitamin C is anti-inflammatory, decreases oxidative stress, and we've had success with this regimen in treating a lot of our patients with acute inflammatory conditions. So I treat the patient in totality, and if you do that, I think you give yourself the best chance for a recovery of any kind, and a full recovery at that. So that's what I have to say on myocarditis. I hope that was helpful. We talk about all these conditions related to COVID, et cetera. What I will say, what we're seeing related to coronavirus infection with increased clots and strokes, or adverse reactions to the vaccine, all of these conditions are conditions that we see in other situations as well. So these things are not new to the planet. I know sometimes, this is never been seen before. All of these things have been seen before. These are similar disease mechanisms that we've seen over the years. So I don't want us to be over alarmed. What I do want us to do is be mindful of the fact that your body has a remarkable ability to heal itself. And if you nourish the body optimally, if you treat it with a natural plant-based diet, proper fasting, hydration, sleep, fresh air, sunshine, exercise, and the right kind of target supplements, your body can heal itself. So regardless of whatever the insult is, you have an amazing ability to recover from it. So let's see. Somebody says, why don't you use whole turmeric? We do use whole turmeric. Excuse me. What we use the liposomal form in the sense that we use because there's a high absorption of it, so we use it. Has cannabis been studied in the reduction of cardiac inflammation? The endocannabinoid system, Yolanda Williams, I'm going to bring some experts on. I don't have a date yet who are experts in the endocannabinoid system in terms of using cannabis. We use CBD oil, and we do have evidence CBD oil has evidence of neurological benefit, and also there's some anti-inflammatory benefit as well. But there are many other benefits of this, and I'm going to bring some experts to help address this question. You always ask a lot of great questions on cannabis, but I do use cannabis in a lot of our patients with inflammatory condition, lots of pain. I had a patient with bad cancer, severe pelvic pain, and I gave her 2 ounces of liposomal curcumin, and I gave her 1 milligram of CBD oil. And before she left the office, her pain was gone. And so that's something that we have seen, and we've got a lot of good reports from our patients. Who is this? This is Bradley Thomas. I'm late hopping on. Good evening, everyone from Atlanta. It is probably 8:38 in Atlanta. How are you doing? And so is there a liposomal turmeric? Well, I'm not sure of a liposomal turmeric. The liposomal they isolate the curcumin, and they put it in a lipid sac to improve absorption. Turmeric is good. I think many people may not be able to absorb, consume enough to get a lot of the curcumin. A lot of our digestive systems are not optimal, and so that may be why getting a liposomal curcumin in is beneficial. But I do advocate consumption of turmeric on a regular basis as in a maintenance fashion. So I think that's certainly beneficial. So anyway, that's what we have tonight, guys. Thank you very much. Again, please hit the like button, the love button, subscribe if you haven't subscribed. Also, hit the notification bell. You'll get some information on us. I'm going to do a couple of talks about our online program this week. So stay tuned. I'll put that out. So hit the notification button so you get notified about those. I'll be talking about detox, the benefits of detox, and how it can help you with chronic illnesses such as diabetes or heart disease or the like. So stay tuned for that. Until next Monday, keep it fresh, natural, and live.